Hello, everybody. Welcome back to the WHN broadcast. My name is Ben Calderwood. I'm happy to say we've got a special edition of sorts on our YouTube channel today. We're going to start by discussing the North Carolina mask ban law with Dr. Eric Feigl-Ding, epidemiologist, health economist, and a regular contributor to the network, and Dr. Jerome Adams, former U.S. Surgeon General. We spoke with Dr. Adams in brief about this ban. You can find that video on the WHN YouTube channel if you'd like, and we're going to expand on that discussion today. Once again, I'll note that as of this recording, we're discussing this on May 24th. The bill was recently voted down in the North Carolina House, but we're going to talk about, the language in that bill and where it stands and what may come of legislation like this down the road. So I want to welcome Drs. Eric Feigl-Ding and Jerome Adams to our little roundtable. Thank you both for joining us today.
I'm really glad to be with you today.
Yeah, thank you so much. And I'm so glad to have this discussion today because in many ways, the shock to the COVID community and the prevention public health community when this North Carolina Senate bill was first proposed with no health exemption as part of the mask ban. It was just incredible. You saw the reaction that was out there. And fortunately, the House, North Carolina House has voted it down. And so now it's going to a compromise stage. So it's not dead yet. But tell me, Dr. Adams, how did this thing even happen in many ways? And what is the long-term implication for such crazy proposal where even health exemptions are not allowed in mask bans?
Well, it's really complicated, as you mentioned. A lot going on here to unpack, and I'll try to be as succinct as possible. But we've got to understand that the background for a lot of this actually were the increase in conflicts related to the Israel and Palestine war that's going on right now, Israel and Hamas conflict that's going on, and a lot of the protests that were going on college campuses. And so you had law enforcement officers who were concerned that they couldn't properly identify people in these protests. That is against a broader backdrop of a continual debate we've had since 2020 on whether or not masking is appropriate and is effective. And so you had the North Carolina Senate repealing. This is what happened. They repealed a exemption that was in a previous law that allowed people to wear masks in public for health reasons, because previously they said no one could wear masks in public. And this goes back to the times of the KKK. So it was a good law that was in place, or a well-meaning law, but COVID comes along and all of a sudden this law prevents people from being able to protect themselves. Well, now you're in an era where many people believe that we're past the worst of the pandemic. And so they're saying there's more harm than good being done because this law is in place, is what they're asserting, because it's allowing criminals to shield their identities. The concern that I had, that you had, that many other people had, is that this law, even if you believe it was coming from an appropriate place from a law enforcement perspective, would have actually criminalized people who were trying to follow doctors' advice, who were trying to protect themselves. And this is particularly worrisome for someone who has cancer, someone who's immune compromised, someone who has a medical diagnosis where their doctor is telling them to wear a mask. But you've also got to understand there are lots of people who are considered to be generally healthy, but who still want to protect themselves from COVID. I want to protect themselves from long COVID. So a lot going on here. But as far as long-term implications, I was concerned, and why I weighed in so heavily, that this could create a dangerous trend that would spread across the country of criminalizing people for protecting themselves and for following medical or public health advice. And I hope that the North Carolina House weighing in, both Republicans and Democrats, and saying, hey, we need to pump the brakes here, and we need to make sure we are allowing health exemptions, will return this conversation from one about criminal justice and one about whether or not you're mad about COVID policies, and one about Republicans versus Democrats, to one about what's best for people's health and what rights do people have to protect themselves and their health.
Yeah. Yeah, exactly. And especially since, 7%, 10% of people have had or have long COVID, that is a huge swath of population. This is not just, nursing home vulnerable people, or just people who have cancer or high risk of cancer or some sort of immunocompromised disease. This is a huge swath of population that is rightfully angry. And luckily, I think the protests as a result of this obviously yielded a different vote in the House. But in certain ways, like in the future, you know how how can we best talk to legislators so that this isn't bipartisan? Like, how can we emphasize this kind of thing so that they don't even attempt this again in many ways? Like, because this frustrating, because these frustrating bills, these partisan bills that was originally very partisan in the North Carolina Senate, and then it was bipartisan voted down in the House. In certain ways, like, how can we better talk to legislators to prevent this kind of disaster and it was, let's be honest, it was a pretty close call that we
It
almost
was.
had dodged this.
No, no, you are so right, and this is something that I talk about actually a lot in my book that I wrote, Crisis and Chaos, about the pandemic and lessons learned from the pandemic. We need to be better at communicating. We need to learn some of the lessons from the pandemic where we made mistakes, and people will disagree with me here, but all I can do is give you my own personal experience. I think that initially, uh, this conversation and too many conversations start off as political conversations: Democrat versus Republican, conservative versus liberal. And that's, I think, where a lot of this started in the House. And it came down to um, whether you believe mask work or whether you don't believe mask work, whether you believe in mask mandates or whether you don't. Very, very political and policy based arguments. And then you saw a vote along party lines. And when I weighed in, I didn't weigh in on behalf of the idea that we should endorse mask mandates, or that or mask masking along political lines. What I said was, look, as a doctor, we should not criminalize people for trying to protect their health. Period. Point blank. And when you put it in the health realm, when you focus the conversation around health, I think that makes it easier for people to come together. And this sounds obvious. It's like, well, duh. But I think it's really easy for us to slip into partisan and political positions, especially in
Yeah.
this country we're in, where we've got a two-party system. And
Yeah, I know, I
unfortunately,
agree.
yeah,
Framing into the health, I absolutely agree in normal times, but at the same time, we know with abortion, where access to abortion is also a health issue, but clearly politics will win over on that. I don't want to go get into that per se, but the focus on health thing generally works. I will agree with you on that, and I think should be the general approach. But clearly, sometimes other partisan things, from gun control to abortion, politics win over. I just
no,
wanted to.
I love this. I think this is an important thing for us to talk about here, because you and I, we agree again on the end goal. I think it's important to understand who your audience is. Are you speaking to a group of voters who you're trying to convince to adopt a health policy? Well, at some point, yes, you have to think in political terms. In this case, the audience was a supermajority Republican North Carolina legislature. And so if you are coming at them with what sounds like liberal talking points, then you're going to lose when that is your audience. And I think that's
Right.
important to understand who your audience is when you're engaging in these discussions. And I want to give people a concrete example. I get asked all the time, Dr. Adams, do you agree that Obamacare is a good thing? Or do you support Obamacare? And if you take a second, even the way that question is asked is in a political framing, because Barack Obama is obviously very much associated with one particular political party and position. And here's how I consistently answer that question. I consistently say, I agree that everyone deserves access to high quality, affordable health care, and I am willing to work with anyone in any policy or legislative vehicle that is going to get us to that place. Because I live in Indiana, which again has a super majority Republican legislature, and saying that you support Obama anything is going to shut people down. And so I think that's important for people to understand, because that's what made this situation unique. Is you weren't arguing to the country. You were arguing to a supermajority Republican legislature, and you had to frame it in ways that made them feel like they could get to a place that was supporting health, as opposed to a place that was supporting liberal
Right.
values.
Right. And I remember in other places, remember the wildfire last year, mass discussion did return a little. And also in Australia, I have colleagues who they said, they also, their politicians don't want to talk about masks for COVID, but you can talk on framing about, well, there's so much dust and so much,
Exactly.
of
Great
these
point.
other pollutants in the air. And then that's how they were convinced that, okay, maybe we should have masks. And I think right now, the other thing, we have this, because we have this such mask wars, there's that latest review by Trisha Greenlaw's group that show masks do work, and they are safe. And but studies in it by itself don't yield change. It has to, again, turn into legislation. And also CDC policies. But right now, for example, the best example was the CDC is recommending PPEs, including masks, for other diseases such as avian flu, bird H5N1. But the problem, the feedback on poultry farms and dairy farms is that farm workers and people working on these farms do not want to wear them, or the industrial farms don't want to give them out, or people are just not uptaking these PPE recommendations. So it's almost like, because the well has been poisoned against because of partisanship for other reasons in the past, that when we're actually trying to put in mask rules and PPE rules on farms for stopping other viruses, it's not working. And I see this also with vaccines, right? Like, because of the anti-vax movement, now vaccine rates for other childhood diseases like measles, pertussis. We have a pertussis outbreak in America. What's going on? It's spilling over. Maybe you could talk about that, like how this blowback problem is and how we can stop it.
Well, again, I talk about that a lot in my book and how we can move forward. And a couple of key things. Number one, we really do need to improve our basic science education in this country. The U.S. ranks poorly in math and in science, but yet you can go on social media and see people all the time debating the statistics and the science of very complex studies and completely misinterpreting them. And I know that's a lot of what you do, Eric, was go online and try to help people understand as an epidemiologist. No, that's not what this study says. This is what this study says. And when you talk about masking, for instance, we don't understand the basic science. We also conflate, again, I think, policies with health and science outcomes, based on that are sometimes based on those policies, or that sometimes those policies are based on. So what do I mean by that? You brought up something that I think people often conflate. Do masks work? Yes, absolutely. Do mask mandates work? Well, the answer to that question is it depends. And so, but people will conflate the two, and that makes it very difficult to have a fulsome conversation about policy versus the science. And many people who are pushing back against the idea that masks work, they aren't really pushing back against the science so much as they're pushing back against this idea that you can't make me wear a mask. And that's the biggest irony about the North Carolina situation, is that the very people who were saying, you can't make me wear a mask, or then turn around and saying, but I'm going to make you not wear a mask. I'm going to make you a criminal for choosing
Yeah,
to
that was the
wear a mask.
most
That was the irony
ironic
of this.
thing. Because I remember the partisan argument for, you can't mandate me freedom, like freedom against vaccines, freedom against mask mandates. But then, of course, now it's like freedom is so hardcore that now you lose your freedom to wear a mask, which is just most illogical kind of a series of arguments that we've gone swung too far on the other side.
And it's
Um,
bleeding into other areas, as you mentioned, and so I really am. I'm glad you mentioned the pertussis outbreak going on in Kentucky. Vaccine preventable disease that has real harm. People die from pertussis. It's still one of the top 10 leading causes of death in children under age 10 in the world. But also, you get pertussis, you're going to have a horrible cough for weeks to sometimes months. You're going to miss school. And so this is not something that we want to subject our kids to, even if you're not worried about your kid dying from measles or pertussis. These are diseases that were horrible, but fortunately and unfortunately, um, most people today haven't lived in a world where
right.
they've seen the full negative outcomes of vaccine preventable diseases running rampant. So here's what you do. We've talked about the problem. Again, one of the things that I think is important, and you talk about those farmers right now with H5N1, you've got to meet people where they are. Uh, Folks, particularly in middle America and rural America, they don't like being told what to do, particularly from people who they don't feel align with their values. We need to be holding focus groups with these farmers and these ranchers. We need to be sitting down and helping them understand the data that we have and the array of tools that are available to help them. Masks aren't the end all be all. Vaccines aren't the end all be all. There's an array of tools, and I think if we lay out what we know, what we don't know, and we lay out the toolkit, and we show people respect, and we build that relationship, that we can get to a good place. There's a saying I
Yeah.
love that I want our viewers to take away: people need to know that you care before they care what you know. And
Yeah.
that's the big take home point, again, from my book, is that we didn't do a great job of showing people that we cared about them, whether their concern was their individual freedoms, or their kids being in school, or their ability to protect themselves from a deadly disease. We didn't do a good job of creating the relationships with people and showing them that we cared, and so they began to disregard what we were
Yeah.
telling them from a scientific perspective.
Yeah, and I absolutely agree with that. I think there's a need for a big tent approach, and first welcoming people to the tent, as opposed to making your this tent as very small and rigid. It's like you're only admitted to this tent if you can be absolutist in following all 10 guidelines and recommendations. And
Exactly.
then that aliens and not a lot of people. Yes, the people in there are absolutely, lowest risk. But in terms of public health, I always tell people that a larger population of people exposed to like risk actually kills more people than, say, a small group of people at high risk per se. So
Exactly.
in many ways,
Well, you're talking about statistics, and the US ranks like 27th
I
in the
know
in the
I
world
can't
in
use
math.
this argument with lay people, but what I think is the back to the big tent is like, if you, it's like, hey, you don't have to follow. I just think of it sometimes dietary guidelines. If you make if technically vegan diet is healthier for
Mhm.
yourself and the planet, but it's not sustainable for currently the general population to all go vegan vegetarian. But if you just say, hey, reduce your red meat. We're not banning red meat. So just reduce it and substitute with chicken sausages instead of pork sausages and beef sausages. It will make a shift a difference, and then over time you can shift them to greater and greater healthier messages. And I think
Well, I don't want
with
people to think
masks,
you and I agree on everything, so I want to bring up a point that you and I have been on different sides of, but we're working towards commonality. And again, that's H5N1 and the safety of milk. So when you talk about
yeah,
moderation, again, I've often said we have to be careful about scaring people off of milk, because for a lot of people in this country, people on WIC, people from lower socioeconomic statuses, milk and dairy products are a big part of their diet. However, you
yeah,
rightly point out that there are some concerning signals out there about viable virus in our milk supply. So the
yeah.
question, to your point, is how do we give people practical recommendations to incrementally be safer, without saying, okay, well, you just can't drink milk anymore?
Right. Of course, like first of all, I'm for ultra pasteurized milk because the latest study shows that pasteurized milk doesn't fully inactivate the virus, the H5N1. And this is the New England Journal paper that just came out. And also, raw milk gets mice really sick. These mice got sick from day one drinking raw milk. So we know raw milk containing the virus is infectious. And I think in certain ways, I'm like, this is the precautionary principle in me. I think we should stick to ultra pasteurized. But you're right. There's, there's a lot of there's a lot of
Lost you,
people
Eric.
who, yeah, there's a lot of people who, do need to drink a lot of milk and do consume dairy as their diet. But maybe you could talk to what you would say to raw milk drinkers out there. And there is a hardcore contingent of raw milk drinkers out there.
And again, to bring it back to the broader conversation, we've got to understand, as you mentioned, who the audience is you're talking to, and as you mentioned, one important audience out there are people who are putting themselves at higher risk or who are at higher risk for whatever reason. And if you're drinking raw milk, we've long known that raw milk is higher risk in terms of infectious ingredients. But right now, in the midst of this H5N1 outbreak, oh my gosh, I would say as a physician, as a public health expert, please, please do not drink raw milk because, as you mentioned, that if it's going to impact anyone in terms of transmission through the milk supply, it's going to be people who are drinking raw milk. The safest
Yeah.
people are the people who are drinking, who are not drinking milk at all. So that one extreme is abstinence, the other extreme is raw milk, and in between you've got ultra pasteurized, you've got regular pasteurized, and the one thing I can say for certain is I absolutely would not recommend to anyone or let anyone in my family drink raw milk right now, or ever, to be honest with you, because of the higher infectious component, but
Yeah,
particularly right now.
absolutely. And although there oftentimes the raw milk traders are selling it as pet milk across state lines, and which avoids any FDA scrutiny because it's not human consumption. And there's a whole realm of like regulatory things that we've, I think, dropped the ball on. But I
But
agree.
that brings
I
up
think raw
another
milk.
interesting point, Eric, that I think we should dig into. And I know we're running short on time, but even when you talk about raw milk, people like to say, well, there was a time when everyone drank raw milk, and we weren't worried about it back then. Just like there was a time before, when everyone had measles parties. There was a time when no one wore masks, and we have to be careful about that logic and understand
Yeah.
understand how to communicate with people and help them understand as we learn more. We try to improve upon our ability to protect ourselves, but we also can't. We got to be careful about trying to scare people that you're going to die if you do this, because that's the other side of the argument that I think we lose people on. The raw milk drinkers will say, "I know plenty of people who drink raw milk, and they're not dead." The people who don't wear masks will say, "I know plenty of people who don't wear masks, and they're not dead." And the
Well,
folks who are
I would also
vaccinated.
argue dead men tell no tales, as the pirates say. In terms of during COVID, a lot of people was like, "Oh, I survived COVID." Yeah, but you survived COVID. You know, those who didn't survive don't get to tell you how horrible it was for them, and they died.
Well, and
Um,
there's significant morbidity. Just because you don't die from it doesn't mean
oh
you
yeah,
have
absolutely.
long
And
COVID
and
or
they
a
did
vaccine you need to die.
analysis, like raw milk caused like dozens and dozens of outbreaks in the
Exactly.
UK in terms of that sickened, a lot of people. So we know this. It's just that, we don't want to go back to the in pre-1800s, early 1800s, in
Exactly.
which we had huge volume of diarrheal diseases. We've come this way. I don't know why people want to go back to, those dark ages before we
Well, we're
invented
victims of our own
pasteurization.
success. People,
I
they
know,
haven't
because people
experienced
don't
it.
remember.
Yeah.
People literally don't remember even what happens in the news like 2 weeks ago. Honestly, like people have such short-term memories, and this is why we have to keep pounding it and with the advocacy.
And that's
So
a good part I think we're getting near time. So I think that's a good way to kind of wrap up our conversation is to end back on advocacy. I think we need to do a better job of educating ourselves and educating the public. We need to do a better job of communicating. And part of communicating is understanding our target audience. And one of the big lessons from this North Carolina situation is that advocacy matters. Advocacy matters. You can't just give up. You can't just check out. If you see something that's going in a direction you don't like, you have a responsibility to speak up and say something. Now, that said, as I mentioned, you got to say it in a way that's going to resonate with the people who ultimately are making the decision. But if folks hadn't come forward and spoken up, then this law could have passed. It was really close, as you mentioned, and it could have been a standard that then played out across the country. I think now we have a real opportunity to reset the conversation about masks because of this, and to say, hey, let's bring this back to talk about health and people's rights to be able to protect themselves, whether it's from COVID or raw milk and H5N1 or wildfires or whatever it is that is out there.
Yeah. So thank you so much for joining us, Dr. Adams. I know you've been actually one of my favorite advocates out there. And everyone, please check out Dr. Jerome Adams' book, Crisis and Chaos. And thank you so much. And I'll turn it over to you, Ben.
I I want to say advocacy is a great note to end on. I think so much of this conversation really has been about how we frame these discussions, right? How we find ways to speak about these things in ways that are most effective. So reflecting on that as a closing thought is great. I want to thank both Dr. Eric Feigl-Ding and Dr. Jerome Adams again for joining us and having a discussion about the North Carolina mask ban and H5N1 and so many other great topics. We'll keep our eye, of course, on the North Carolina mask law and see what comes of that, and probably we'll be discussing it again in the future. Finally, a little bit about us at WHN. The World Health Network is working to end the COVID pandemic as a global health threat. If you'd like to learn more about the organization, we do hope you'll check us out at whn.global. We hope you'll visit the website. Consider joining us. Thanks again. Thanks again to our guests. We'll see you next time.